All right, welcome to Oncology Data Advisor. Today we are here at ONS Congress in Washington, D.C., and I am joined by Dr. Jessica Macintyre, who is the incoming president of the Oncology Nursing Society. Thanks so much for coming on today, Jessica.
Thank you, Kira, for having me. I appreciate that.
Yes, we're really excited to talk with you today.
Thank you.
We'd like to start off by introducing yourself and telling us a little bit about what your work and your research focused on.
Yeah, definitely. So, my name is Jessica Macintyre. I've been an oncology nurse for over 22 years. I primarily work at University of Miami Sylvester Comprehensive Cancer Center. There I have a little bit of a dual role. I am a practicing nurse practitioner. I do a lot of clinical work around the survivorship program. I see patients in our survivorship program. And then I also am a healthcare administrator at the Cancer Center, and I oversee various programs, including cancer support services, our social work team, everything that a patient needs that's adjunct to treatment. That's what I help with at the Cancer Center. My role at ONS, I am, part of the board and coming in this year as the president for the Oncology Nursing Society.
Amazing. So what are the things that your research is focused on over the course of your career?
Yeah, so I think I focused on a lot as a practicing clinician in clinical trials in general. So administering clinical trials, new innovative drugs. I've worked in the phase 1 clinical trials area. But now my research is really focused around oral adherence to chemotherapy, especially oral chemotherapy, and using digital technology to really understand if it's a good tool for patients to adhere better and have better outcomes while on oral chemotherapy.
Awesome. So have you been enjoying ONS so far this week? Are there any interesting presentations you've seen?
Yeah, I've been really taking it all in. It's a lot. If you're a first-time attendee, definitely taking tips from Congress 101, that session that they have for new attendees is really helpful. I think the big lectures are always great to go to. So the opening keynote was amazing by Kelsey Tanish. And then this morning I went to the ONCC certification breakfast where we had a very motivational speaker as well with a lot of humor. And then now we had the Mara Morganson Flattery lecture. And that was very touching as well, because I think from all three speakers that I've heard, their message has been about perspective and having a different perspective and understanding that not everybody looks and is the same. When you look at them, they may be going through something different, and taking the perspective and getting ideas from different perspectives. And so I think that's been a really nice message to have as like an encompassing message from all three speakers, is that really you have to be open, have different perspectives to be able to change things and to move things forward. And I think that goes with the conference theme about igniting the extraordinary. Yes. When you get those different perspectives, you get different ideas, and you really do change the lives of patients from that.
Yes, absolutely. I agree that the keynote address was very inspiring, and it's been wonderful just to walk around and look at the posters here and see all the amazing research being presented.
Yeah.
So what are you most looking forward to about your upcoming term as ONS President?
I really think the most I'm looking forward to is really connecting with members and really understanding how can we help them from an organizational perspective. What are their challenges in their work, and is there anything that ONS can do to really provide them resources to support them in their role as oncology nurses, and really understanding, what we can do to help retain early career nurses, and also involving nursing students and understanding, how if they want to be able to have a professional, job in oncology, what is it that they're most fearful of, so that we can help them with those challenges and really try to propel the next generation of nurses into oncology nursing, because we need them.
Absolutely.
I'm not going to be around for very long, and in the future, and so I need somebody that's going to take over the reins. And so we really need to encourage our next generation of nurses to really be at the forefront and take the reins and really love what they do as oncology nurses, and be able to help them and support them as an organization.
Absolutely, that's wonderful. So what are some of the goals and plans for ONS over the next 2 years?
So we do have a strategic plan that we follow now. We have certain objectives and tactics that we've been undertaking, and in 2026 we'll have a new strategic plan that will be devised by our board of directors. And I think what we do with that strategic plan is kind of like our North Star. It's what we look at and what are our priorities, so that we can really focus on things that are really important, not just to the organization, but to our members, right? And how can we move the organization forward? How can we move oncology nursing forward? And so many of the tactics and objectives in our strategic plan really focus on that. And really it's our guiding principle to be able to help support this organization more every single day with a lot of the things that are in our strategic plan. One thing is definitely education, right? We're like the resource for oncology nursing. So really helping other schools of nursing and other organizations understand how can we provide the education to you? What is the best format for us to provide that education? What is that your organization needs? Are there trends now that are happening within non-oncology that we need to also focus on? Like emergency room medicine, ICU, because everyone sees an oncology patient, regardless of what area you work in,
Right.
not just in cancer nursing. And so we want to be able to support those nurses too that need resources to be able to care for those patients in the best way possible.
Absolutely. I'm looking forward to seeing all of the changes and all the impacts that are made over these next few years.
Thank you.
So I really like the theme of ONS this year, which is Ignite the Extraordinary. So going into this, how do you fuel your own motivation and passion as an oncology nurse, and how are you hoping to ignite the extraordinary in ONS during your term?
So for the first question, I always say this to everyone that I meet, and it's my patients that really motivate me every single day. I always go back to stories that I've had, as a new oncology nurse, and that really have propelled me to continue being an oncology nurse. It's about the patients, it's about the families, and really that connection that we have with them is really always what motivates me, and also what they need from us, what we can provide them motivates me to be there for them, to be their support, because we're there more than anybody else is.
Yes.
So I think that's really what propels me. And what also motivates me is how advanced we've gotten over the years, the treatments that have come along. I was telling this story to somebody else the other day about how I remember Zofran being the only thing that I was able to give, but many of my colleagues only remember Ativan being the only medication being able to be given for nausea and vomiting for patients on chemotherapy. And now we've come such a long way with other agents that really, nausea vomiting is a thing of the past, and now patients are really not concerned about that. They're concerned about other things, other side effects. And so we've come a long way, not just in treatments for cancer, diseases and diagnoses, but also for supportive care for nausea, vomiting, and for so many other things. And I think that's really what motivates me, is knowing that we're still advancing and we still have so much more to do, and we've come such a long way that I know one day we'll get there to a point that if a patient has a cancer diagnosis, we'll have that treatment that's going to cure them for that specific cancer, and hopefully one day we'll get there.
Absolutely, yes. Seeing all the advancements definitely sparks that motivation for seeing where we'll be one day.
Yeah.
Awesome. Well, thank you so much for stopping by to talk with us today. It was really wonderful to meet you, and we're looking forward to everything that you'll accomplish as ONS President over the next couple of years, and looking forward to ONS Congress in Denver next year for the 50th anniversary.
I hope to see you there.
Yes, absolutely. Thank you again.